it's all about. Check it out. I'm gonna light it up. Yeah, I'm gonna light it up. Let me show you what it's all about.
Welcome back to the Medicaid Mythbusters series, where we clear up common misconceptions about Medicaid and how it really works. Today, we're tackling the misconception that Medicaid cuts don't affect Medicaid beneficiaries. But spoiler alert, cuts to Medicaid are cuts to Medicare. People think that cuts to Medicaid only impact Medicaid recipients, but that's not the full story. If Medicaid funding gets cut, it can affect people on Medicare in a major way. How? Let's take a step back to understand the differences between the two programs. Medicare is a federal health insurance program primarily for people who are 65 or older, certain younger people with disabilities, and those with end-stage renal disease. Whereas Medicaid is a joint federal-state program that provides health insurance coverage to low-income individuals and families, including children, parents, pregnant women, seniors, and people with disabilities. Keeping that in mind, did you know that 1 in 5 Medicare enrollees rely on Medicaid to help pay for their healthcare costs that aren't covered by Medicare? Like long-term care, premiums, co-pays, and what would otherwise be out-of-pocket healthcare expenses. Without Medicaid, after a lifetime of working hard for a living, millions of our elders, I'm talking our grandparents, our parents, could face skyrocketing out-of-pocket expenses just to get the care they need. Medicaid helps cover important services that Medicare doesn't, like long-term care for people in nursing homes or folks who need help at home and certain prescription drugs. If Medicaid shrinks or faces massive cuts, millions of seniors and people with disabilities could lose access to these crucial benefits. I did not know that. So you're telling me that Medicaid is essential for Medicare beneficiaries too? Exactly. And get this, nearly 30% of Medicaid funding goes to people with Medicare. That's a significant chunk. If Medicaid funding is slashed, it directly impacts the coverage and services Medicare beneficiaries depend on. Oh, yeah, and Medicaid is almost the primary payer for 63% of nursing facility residents, like our parents and our grandparents. Without Medicaid, many people in long-term care would be unable to afford the services they need to live with dignity. And here's another big one you may not know. Not all people who are on Medicare and who also need Medicaid are seniors. Almost 40% of the people enrolled in both Medicare and Medicaid are under the age of 65 and eligible for Medicare because they have a disability. Bottom line, without Medicaid, over 12 million Medicare enrollees could see their care interrupted. So we need to protect both programs for the health of our communities. Let's be very clear, the real drain on our system is billionaires and big corporations who don't pay their fair share in taxes and still want even bigger tax breaks. And they want to pay for these tax breaks by destabilizing our system of healthcare built by everyday people. We should be investing in programs like Medicaid and Medicare. These are the programs that people need to get care and live healthy lives.